The correct preparation, priming, and disposal of the OMNI Surgical System can be learned by viewing this short instructional video. Before we begin, there are a few specific features of the OMNI Surgical System you should be familiar with prior to priming the device. The lure fitting. The handle to grip the OMNI surgical device during priming. The cannula. Note the finger wheels to prevent inadvertent actuation after lure removal. Carefully remove the OMNI Surgical System contained in a sealed tray from the individual unit box. Set the box aside. The non-sterile surgical technician should identify the gray arrow on the Tyvek cover and peel the sterile lid barrier from the tray using the exposed edges. Completely remove the cover from the protective tray. Notice that the cannula should be pointing away from the user. Notice that the back of the tray is designed so the user can firmly grip the underside without creating high device removal resistance. The sterile surgical technician will then remove the OMNI Surgical System from the protective packaging tray by grasping the handle below the advancement wheels, then lifting and removing the cannula side first. Make sure to handle the OMNI Surgical System carefully to avoid kinking or damaging the cannula. And avoid touching the cannula tip to any surfaces, as this may damage the tip or compromise cleanliness. The sterile technician will then place the device in a sterile field and inspect the device closely. Do not use if the device appears to be damaged. If you are satisfied with the inspection, set the OMNI Surgical System aside. Now, the non-sterile surgical technician should open the viscoelastic packaging, and the sterile technician should remove the viscoelastic cartridge from its packaging. Do not use any separate nozzles or needles, including those provided with the viscoelastic cartridge, as these may damage the OMNI Surgical System. Ensure there are no air bubbles inside the cartridge prior to attaching to the OMNI Surgical System. As a reminder, only use cohesive viscoelastic to prime the OMNI Surgical System. Do not use with a dispersive viscoelastic fluid. Now, you're ready to prime the OMNI Surgical System. Start the priming procedure by grasping the distal end of the OMNI Surgical System, supporting the lure fitting from inadvertent rotation. The viscoelastic cartridge should be attached directly to OMNI using the mating lure lock. While securely holding OMNI, attach the OVD cartridge to the lure fitting, rotating the OVD cartridge clockwise only. The user must rotate the OVD cartridge clockwise only to engage the lure fitting. With one hand supporting the OMNI Surgical System and the other the OVD cartridge, hold both upright and keep in straight alignment. Note, do not apply bending force nor rotation at the lure fitting junction. While holding the combined OMNI and viscoelastic cartridge vertically, apply force to the OVD plunger. Gently and slowly inject viscoelastic into OMNI for approximately 10 seconds. Continue applying gentle pressure until viscoelastic flow is visualized coming from the distal cannula tip. Once viscoelastic is seen flowing from the cannula tip, the OMNI Surgical System is fully primed with cohesive viscoelastic, and air should now be fully flushed from the device. Now that the OMNI Surgical System is primed, the surgical technician should remove the viscoelastic cartridge from the OMNI Surgical System by turning the OVD cartridge counterclockwise. Notice that the OMNI Surgical System's lure lock may detach with the removal of the OVD cartridge. The lure must be removed from the device, and this is done by counterclockwise rotation. The OMNI Surgical System is now ready for use. Place the OMNI Surgical System on the surgical tray. The OMNI Surgical System can be disposed of following the facility's procedures for sharps and biohazardous waste disposal. If a complication occurs, retain the OMNI so it can be returned for analysis.